Well, hello, everyone. Welcome to one of many educational webinars that SAMBA will be hosting this upcoming year. Today, we'll be reviewing what medical directors should know about infection and prevention at ASCs. This will be led by Dr. Leo Rodriguez. I am Dr. Catherine Tobin. I'm an associate professor at the Medical University of South Carolina in Charleston. I'm also chair of the Education Committee for SAMBA. I will be moderating this webinar. For those of you that are not members of SAMBA, please consider joining the society, as it offers many benefits to members. You can visit our website and see the benefits. In addition, you can listen to previous webinars online. A few quick housekeeping notes before we get started. In the upper right-hand side of your computer screen, you will see a control panel. Please note this webinar is in listen-only mode. Submit your questions in the question box at any point during the presentation, and I'll be reviewing these during the presentation. At the end, we'll have time for a Q&A presentation where I'll read your questions out loud. I'd like to now introduce Dr. Leo Rodriguez. He's a native of Venezuela, and he is medical director of a surgery center in Aventura, Florida, where he's done that position since 2008. Dr. Rodriguez is also president-elect of SAMBA. He's the vice president of the Florida Society for Anesthesiologists and a member of the ASA Committee on Ambulatory Surgery Care and CPOM and other committees. Let's now welcome Dr. Leo Rodriguez.
Well, hello, everyone. I'm happy that you joined us for this presentation. It's the presentation. A lot of the material that I have is known by a significant number of you, but unfortunately is ignored by a significant amount of anesthesiologists. And my goal in this presentation is to see infection control from like a chief medical officer point of view. And we're gonna have, sorry, my presentation, okay. So the learning objectives of the presentation are, first, we're going to define what healthcare-associated infections are and why should we care. Then we're going to review a few cases of infections that originated in the healthcare system. We're going to see the gaps that occurred in those infections, and then we're going to address those gaps to prevent other infections from occurring in our environment. I have two disclosures, but my disclosures have no influence on any part of my presentation. Ambulatory surgery at the moment in the United States, we have approximately 5,500 certified surgery centers by CMS. In 2015, approximately 3.4 million surgeries are performed in Medicare patients in the United States. And about $4.1 billion from the Medicare budget is spent in ambulatory surgery. So the government, obviously, based on these numbers, has a significant focus on prevention and infections because they want to decrease the expenses in complications from any kind of surgery. This graph comes from the American Hospital Association, and what it shows is the shift that has occurred from inpatient procedures to outpatient procedures. So as you can see, between 1994 and 2014, the number of surgeries have increased to above 63% in the United States that are being performed in outpatient surgery, not necessarily ambulatory surgery centers, but in hospital outpatient departments, non-operating room environments, and ambulatory surgery centers. And at the moment, it's estimated that approximately 30 million surgeries are being performed in the United States in the outpatient settings, including the office-based settings. So what are healthcare-associated infections? So a healthcare-associated infection is an infection that is acquired while the patient is receiving care for another condition. Infections in ambulatory surgery settings are relatively infrequent in comparison to a hospital setting, but when an infection does occur, it causes a lot of cost for the healthcare system. It is estimated that right now about $30 billion a year is spent on healthcare associated infections and the management of patients that suffer this type of infection. And the trends are that if we continue the way we are, they could increase, because now we're developing multi-drug resistant organisms. One of them is the VRE, which we know that is transmitted by person-to-person contact. So if you have a patient that comes to a facility, the patient's colonized with VRE, and the healthcare providers don't take care of the things they have to do, then the next patient could suffer